Hello everyone, I am Nurse Latoya Silveri and I am a Jamaican oncology nurse working in the beautiful island of the Turks and Caicos. Being from the Caribbean, my patients can be adversely affected by climate change. I would like to speak to you about three of those topics: UV radiation exposure, hurricane and tropical storms, flooding and landslides.
Ultraviolet radiation exposure. The Caribbean islands provide year-round sunshine, beautiful beaches, and chilled out vibes. We also know that most skin cancers are a result of excessive exposure to UV rays in sunlight. It is recommended that all residents use sunscreen every day, even if cloudy. Wear protective clothing like long sleeve shirts and hats and limit the amount of time they are in the sun. This is emphasized to our oncology patients, especially those receiving chemotherapy that is likely to thin the skin. This can also affect patients taking certain medications, where photosensitivity is manifested by an exaggerated sunburn reaction when skin is exposed to direct sunlight.
Hurricanes and tropical storms. The Atlantic hurricane season runs from June 1st to November 30th, and there is an average of 30 named storms every year. On September 19th, Hurricane Fiona traversed the Turks and Caicos Islands. There was flooding, scattered debris, fallen trees, power outages, and loss of mains water, along with a few damaged properties. These adversities caused delays in my patients accessing and receiving oncology treatment. The length of these delays is dependent upon post-hurricane damage assessments and the lifting of the lockdown. Only then can I make plans to rearrange treatments.
Floodings and landslides. These pose challenges if patients are unable to leave their dwelling and attend the hospital for treatments. Health ministries and healthcare facilities across the Caribbean have established emergency and disaster management plans. For example, if a flash flood is imminent, patients are advised to move to a higher ground, seek help, and take along a pre-packed bag with medical and disaster supplies.